Hello, welcome everyone. My name is Laura Kopec, and today I'm going to talk to you a little bit about myself as a professional practitioner and educator, business owner, and a little bit more about my business, my practice, and how we're growing and expanding. As an invitation for you to come and see me, schedule an appointment. If you're a provider, it'll give you more information about how to refer to me. All right, so let's get started. Again, my name is Laura Kopec. You can find me at either one of these websites, my name, laurakopec.com, or my practice, Kopec Functional Wellness. Kopec Functional Wellness is my practice, my wellness center, my business. I have been in business for more than 15 years, and it's an ever-changing, growing, and expanding, and I'm so proud of where I've come from and where we are and where I'm going. My credentials: I have a Master of Arts, I have a Master of Science in Nutrition and Health Education, I have a certification in Holistic Nutrition, and a certification in Genetics and Genomics. My gifts include that I can wear many hats, and I often wear them at the same time, and sometimes you'll just see me in a different arena. So I am considered a traditional naturopath, a functional practitioner. I'm also a published author, and I host Health Matters with Laura Kopec. I'm also a functional life coach and a health educator. I take a lot of pride in educating people on their health, what's going on, really unpack it as a functional provider, get to the bottom of some things that are causing some of the issues, and then even look at how the body might keep the score, looking at the emotional and other sides of imbalances that can participate in how a person is not fully recovering, or how they might see a pathway to getting a complete recovery. In my podcast, I really love to demystify some of these health issues and really clarify, and also really educate people, again, in really simple terms. I'm really passionate about helping people understand their health and take charge of their health. My professional journey in this arena began in 2007. That's when I first started my business. I had a prior career in education, and my first master's thesis was on social learning theory, rooted in educational psychology combined with art as therapy. And I really found a new way of looking at how human beings participate in learning. And again, I really do use that in my practice, because my primary goal is to help people understand their health and then take charge of it. My first certification was in holistic nutrition. That is where I had my first interaction with integrated pediatricians and pediatric practices. I was also looking at taking a skincare line that I had developed, a holistic, all-natural skincare line, and bring that to market. I did accomplish being in 6 of the Dallas-Fort Worth Whole Foods markets for a period of time, and I was really proud of that process. Right now, as far as product goes, I do retail nutritional supplements. I have a complete online retail store of holistic products, and I am looking at bringing another particular nutraceutical nutritional supplement to market called Dopa Zest. So I still feel very passionate about product and bringing good quality products to people, because that is part of how they can really take charge of their health. So within 2 years of consulting as a holistic nutritionist, I determined I had a really big passion for this. And then I really extended that passion and interest into functional medicine and education of health, which is what led to getting my Master's of Science from Hawthorne University. It was an incredible experience, and I really take a lot of pride in that process. So I really do feel that I've kind of integrated both of my master's degrees And it's been a really special way of interacting with people and helping them. My first book was Let's Get Real About Eating. I wrote and published that book and was picked up by Barnes and Noble and had my first book signing at one of the Plano locations. So I was really proud of that experience, and that took a lot of hard work and determination. And really becoming an author really, again, expanded and honed in on how I want to be an educator and how I want to help people really understand their health. And shortly thereafter, I went and had my doctoral certificate in traditional naturopathy. And again, just really honing in on what I am providing for people when they come and they meet with me, what I am providing to the public when I'm stepping out as an educator. My next book is called My Kid's a Picky Eater. I created a blend of nutritional advice with educational strategies and parenting strategies for parents to have a different understanding of eating clean and setting good boundaries around food. I think there's a lot of misunderstanding about what is healthy eating and then what is the role of the parent in the home when it comes to healthy eating. So I really do think that that's an important thing to start thinking about. We have a really unique relationship with food. That is a relationship, and it does start in the home with the way that our parents are teaching us to navigate relationships. So I think that's a really important thing that I bring to the table in a really unique way. I have done a lot of public speaking. I really enjoy that as well. I really find that I can reach people, again, in a really unique way. I've been the keynote speaker for the Nutritional Association of the National Association of Nutritional Professionals, and I've done a lot of different courses in a variety of different subjects. I started my podcast, Health Matters with Laura Kopec, when less public speaking were happening around the initial COVID experience. And so I really kind of pivoted and expanded the way I interact with people and bringing that education into a public forum. And so throughout that first year, really kind of getting an idea of what was really important to me. And I have a really strong identity in my podcast that I really want to demystify. There's a lot of misinformation out there, and just even a lot of information. And how do we navigate that information when we're trying to understand our health and take charge of our health? So this will help people kind of have expanded viewpoints on their health and their wellness. Recently, I went back to school. I pursued getting a certificate in genetics and genomics with Stanford School of Medicine. It actually wound up being even harder than my master's degrees. I don't know if that's because it was Stanford or because as we get older, studying is harder, but also the language around genetics and genomics is pretty complicated. So I'm really proud of that process. And also, there's a lot of holistic training in genomics, but there isn't really that next level. And it was really important to me that I could be the information, the expanded information that people needed, not just from a holistic perspective, but really helping people understand, because as genomic testing became more popular, it started to be seen as genetic testing, and there's a ton of misinformation around it. So it's really important, again, that people have a place that they trust, that they can get really good information that they can understand. Recently, as I've expanded my practice, I've added some groups, classes, and workshops for a holistic mom support group. I run a Mind, Body, Spirit book club and functional wellness, fun and learning with classes, workshops like creative healing around trauma, being financially healthy and fit. So that's just kind of been a really, again, an expanded way that I'm reaching all different kinds of people in an educational way. And recently I've started formalizing provider training around functional testing, because sometimes the experience that they're getting is limited. And so to give them more of a kind of and experiential type of education is pretty important to me. So I do have a full line of retail, high quality, great prices. We ship out the same day. We have pickup options. And of course, consulting, working one-on-one with me. I do believe in being affordable over the long run, because sometimes launching into natural health and wellness or doing a deep dive into functional testing is not affordable in the sense of the way people think about affordable. I do think my prices are really competitive as to what is happening across the country, but it's really important to me that the navigation of somebody's health over the long haul really becomes truly affordable, because people get better, they get results. My style is mapping things in a way where we can really narrow down the products and the way that we want to do things, so that over time, those things don't even need to be really in someone's care plan, treatment plan recommendations. Recently, I've added an IV therapy room, an IV lounge. We do a lot of different things like vitamin C drips, detox. Those contain a lot of different natural nutrients, immunity, anti-aging, weight loss. There's even one for anxiety. We'll do some special add-ons like glutathione. You may have heard of the Myers IV protocol. We do offer that, and even some injections like B12. That is open to the public. You don't need to have that initial consultation to come into the IV room. Ages 16 and older is open to the public. And again, classes and workshops open to the public. A lot of them are free. And so it gives you an opportunity to kind of really explore what's going on in the community or the community we're putting together here in health and wellness. And again, check out the podcast, the YouTube channel. Those are all really easy ways to access some really good quality information. So we are expanding. When I first started, it was just myself, and sometimes I would have an assistant. And so now, with being in a new location where we have a lot more rooms, the IV lounge, the classroom, different things, we brought on a certified nursing assistant who runs the front desk, does order fulfillment. That's Luke Thane. Melissa Irving, she does some admin stuff behind the scenes, some marketing and social media. And recently, Heather Kinder, she is a nurse practitioner on staff, and she's also running our IV room. My approach and my goal is to be educational above all things, to be comprehensive. I do have a very unique way of operating as a functional practitioner. I want to be as comprehensive as possible, and then strategic, especially in the initial recommendations, not to overwhelm someone, but still get results, kind of finding that happy medium. And then the sustainability, really identifying in working with people and developing that relationship, what is going to be strategic and sustainable? What is going to bring them results? Because really everybody's so unique, and their relationship with their health is part of their relationships with themselves. It sometimes can include their relationship with food. And so my feeling is doing something is better than doing nothing, and really trying to figure out the pathway and looking at that individual and figuring out what is best for them. So I want to create this environment where people feel they really understand their health. They really feel that they can see things in functional test results, and that it's really comprehensive, where they understand that it makes sense and that it provides them the best scenario for long-term change. If you are a provider at a pediatric office and you're interested in thinking about referring to me, here are some ideas for you. Breastfeeding moms with colicky babies or babies with skin issues. In a pediatric office, you're really only treating and working with the child. And when I mom is nursing, you really have two bodies that are still connected. And so it's an opportunity to get that mom good exploration, functional testing, looking at gut health, looking at how that's impacting her breast milk and nutrient deficiencies that might be impacting the way that babies sleeping, detoxifying, processing nutrients. So I do think I have such a passion for this type of referral, because I do think it's super important that these moms get help and that they're just not thinking about bringing their babies into the pediatrician, because when they're nursing, it is really kind of an overlap. There's still very much a kind of a joint system going on. Fertility, if you're hearing that some of your parents are having trouble getting pregnant again, that might be an opportunity to refer someone my way. If you're having unresolved issues due to the fact that you really need somebody to spend more time either going over their test results or pursuing functional testing or additional functional testing, or they just can't figure out how to follow their care plan because they don't understand what's happening in their body or why something has been recommended. So again, that educational time piece, I can spend extended periods of time with people where that may not be an option for patients in a holistic or non-holistic practice that's just running a little bit more traditionally in terms of time. I'm really passionate about mental health, anxiety, depression, some of these issues. If you have teens, I know that teenage mental health is a growing issue, and there's an opportunity for people to come over and do some extensive functional testing. I offer this great functional neurohormone panel, coaching support groups. We really do support teenagers struggling with mental health issues. And that's a really great opportunity to help, because it's not always going to be the solution for these teenagers to be on medication. Either it doesn't resolve their symptoms or it really isn't targeted to them, or again, with a developing brain and developing hormones, it may be a greater risk to put them on medication for mental health. We will step in as a referral, will step in where needed. And so we won't take anyone off their medications. That is the job of their provider who is writing that prescription, but it is an opportunity to really see what are the other sides of things. You know, in the support group, we get to look at when it isn't even anxiety or depression as a symptom, but more a message of navigating the developing of their brain and their critical thinking skills. Referring parents over where they could be maybe contributing to the issue because their mindset, their own issue, their own lack of boundaries, their relationship with food, really exploring that and diving in deeply to that with parents. Because again, in a pediatric appointment, you're not going to have the time to really step in and educate parents, really tease out. I find that people think about themselves as healthy eaters and they really don't understand that. And that also then brings in the relationship and boundary issues with food and nutrition, because it's complicated and it's not really simple, and it's really looking for ways of really helping somebody navigate that strategically. If you have someone with a significant number of food allergies, they're trying to work through elimination diets or trying to get to the functional cause of the allergies and why someone might have such a overactive or underactive immune system, and looking at that. If you're wanting someone to really spend more time on a weight loss or weight gain program, and because again, navigating that on their own may be a little bit challenging. Chronic issues like migraines, headaches, or chronic pain, it's a great opportunity, again, if they're not getting results, to look at what could be going on underneath. And then of course, again, our IV therapy, autoimmune, asthma, detox, chronic issues, again, ages 16 and older, open to the public. ages 12 to 15, we do require referral, and there's some limited options on what we can do with teenagers under the age of 16. If you're an adult provider and you're wondering who you should refer to me, here's some considerations. Again, if you want someone to look at their pre-diabetic, gestational diabetes, how can we help babies' long-term health if a mom is pregnant, or how can we put a stop to someone progressing into full-blown diabetes? So in that early stage is the most appropriate to send someone to me. Again, fertility challenges. It's really helpful to do a deep dive and really look at where things are happening, whether there are some genomic risk factors to inflammation, or whether or not, again, there's some significant nutritional deficiencies or some digestion issues that are causing an absorption issue. And so really kind of doing that deep dive there. Prenatal health and wellness, again, if someone needs more time and a deeper dive into their health, I'm just really passionate about helping women get their best start. Thyroid, it's a complicated issue, and it's not just about getting TSH numbers or other T3, T4 looking pretty on labs, because a lot of these women, they're still symptomatic. And so it's really about how do we bring about balance into the body. I kind of like to think about the thyroid a little bit like a second gut, and the adrenals a little bit like a second brain and a second heart for women. And women's health is very complex. And I find in the fast-paced medical practices, we don't really spend the time to do a really thorough job of going into those deeper dives and mapping it out, kind of figuring out what's going on. Again, mental health, anxiety, ADD, ADHD, OCD, really, again, that functional neuro panel, I'm so excited to help people navigate this in a sound and educational and a holistic way, should they choose that. Perimenopause, menopause, again, hormones, fairly complicated. Women just think hormones, and it's bigger than that. It's not just hormones. And oftentimes hormones are coming back in the normal range. It's something else. It's maybe the way their body is responding chemically to stress, what's happening in their sympathetic and parasympathetic nervous system, what's happening to their neurotransmitters and their response, and how they're navigating those energy, emotion, all of those symptoms. And again, those chronic issues, again, a great opportunity to help someone really unpack that and see, you know, in migraines, it's fairly complicated. Headaches, I've seen where it's nutrient deficiencies. I've seen where it's major gut imbalance, and I've seen it where it's kind of a combination, but also connected to hormones. So it's super interesting to kind of peel those layers back and really figure out then the combination of what will help bring that person into wellness. And again, we have our IV therapy, accelerates results. A lot of those nutrients that I recommend that show up as deficient in test results, again, we can get an accelerated progress and results by doing that, if that's something that an individual is open to. So again, other opportunities, support groups, classes. Right now, our groups include a provider support group, helping integrated and holistic providers just feel a sense of community, and holistic moms group, again, making sure that we're rallying around people that are trying to navigate this in a sense where they feel a variety of opportunities to feel supported, to feel educated, to feel that they can take charge of their health, their lives, their families. Our young adult anxiety group runs in 6 weeks cycles so that we can create the safest emotional space for people. And again, I am a big believer and passionate about education, right? When you refer to a function, not just a functional practice, but a functional time-based practice, you're offering more to your parents, you're offering more to your patients, because they are more likely to be compliant. They are more likely to be committed to their health if they understand it, if they feel listened to, if they feel that the right information has been presented to them, and that they can then embrace the whole experience, the learning tools, the strategies, and then take step forward to managing their health differently. And who doesn't want better and easier to understand information? If you already sell nutritional products and you have them on hand, but you might need something different, or you might need something right away, if you're local, we're available to you. And again, that IV ages 16 and up is open to the public. We do require referral for ages 12 to 15. And then there's some limited options for those young people. But we do really feel strongly about individuals for chronic conditions such as asthma, autoimmune, detoxing for whatever that is, pathogens, mold. And if you're just really tired and depleted and really need to come in, or if you really just need some accelerated results. So offering that opportunity at a discounted rate, because definitely this is part of what I want to offer to people, is the accessibility and as affordable as we can in a sustainable way. All right. So in summary, I have a great respect for all of you that are in healthcare and all of you that are pursuing holistic living. And I have that respect for the way individuals want to manage their own health. And so blessings to you in the field. If you're considering referring to me and you've come to the end of this presentation, or again, if you are an individual looking for something different to be in companion with another provider that you're seeing. So I hope that when you come to me, when you refer to me, that you trust that I'm doing my best, as I have as much experience and expertise to offer those who are looking to gain better health and wellness. I am my own practitioner, educator, and business owner, and I do consider the best interest of a person's health, no matter how they come to me. Thank you.